Welcome back, everybody. If you want healthy skin that looks young, it starts with prevention. But no matter what phase you're in with your skin, a good regimen can help restore healthy, younger-looking skin. So please welcome back Dr. Richard LeConey from the Institute of Anti-Aging. Also with us, the clinic director, Dana LeConey, and patient, Cindy Gaston. All right, I want to take a look at this picture right here because there's two things you can do. Prevention is probably the best thing, but we don't always do that. There are procedures that you can do along the way to kind of restore skin. So this is a picture of a woman who, this is what she looked like with all her skin damage.
This would probably look what she looked like, you know, if she'd been perfect all her life and worn her sunscreen every single day and cleansed her skin properly. And of course, then there's the aging process, which, you know. But yeah, what we start with is we try to, you know, put together a prescription for optimal, beautiful skin. Obviously, the earlier we can get to them, the better, along the line of prevention. So at the age of 6 months old, if you start protecting, there you go.
Right?
Absolutely. Or younger, you know, younger.
And there's a regimen you have to follow. It takes work, just a little bit of work, if you want to have that payoff of great-looking skin. A daily treatment, for example.
Daily treatment program. And we start off with a good evaluation. We obviously examine, we can take their history. We do have a very interesting computer-based complexion scanner called a Visia, which gives us some clues and tips, too, as to whether how much sun damage they have and what other things they may need.
Because you can actually see what's coming. If you're 35 and thinking you're cute, you can see what's coming.
You can. This thing just gives you a little glimpse of the future. It shows all the sun damage that you've accumulated over the years, but hasn't really, you might say, come to the surface yet.
Yeah.
Because unfortunately, the skin does have a memory. You know, it's going to remember all those sun exposures.
Okay.
And then we put them on a program, some at home, and some things, of course, are going to be more prevention, good quality sunscreens, corrective factors to help rebuild the moisture content in the skin, to reduce the brown spots.
And talk about this product, because there's tons of things that we can get over the counter, tons of things, but what's the difference with buying something like this?
Well, you know, this is a program, and it is developed by Dr. Baji, who's a very noted dermatologist. We use most of the components of his program. We sometimes add other components as needed. There's even a few that we've, you know...
So it's physician grade.
You know, exactly, that we've developed ourselves. So that's the beginning. That's what they take home, and that's what you're going to do every day. To kind of help maintain, protect, and go forward. Okay,
and now in the monthly, there's some things that we should do.
Now, then we talk about things we can do for you. Obviously, we have, today we're talking about the treatment called the Hydrafacial. Now, this is a spectacular new machine that really, kind of sense, has 4 functions at once.
Yeah.
Before, you'd have to do 3 or 4 treatments to equal what this does. But first, of course, like the old microdermabrasion, it deep cleanses the skin and exfoliates the skin to open up the skin and allow it to breathe. The next thing it does is infuse under a low-pressure infusion system hyaluronan, which is, we've been here before, talk about that's the natural moisture agent for the skin. It holds water molecules. It is really nature's own skin plumping agent. And it infuses the hyaluronan deep into the skin to give a visible, almost immediate plumping effect.
Yeah, and
it's the only hydrating facial on the market.
Yeah, and you can actually see the impurities coming out, can't you?
Oh, yes, look at this. You can see the dead skin. You can see, like, the oil, the sebum and the oil and the pores. So it actually helps reduce pore size.
Yeah. And Cindy, got to ask you, you are how old?
Over 50.
Over 50, she says. A little midway point there. Where are all your wrinkles? They're not there. Okay, so...
And it extracts the comedones from the pores. It does a beautiful job of cleaning them out.
Yeah. All right, so that's something we could do monthly. And then the thing you can do every 3 to 4 months, because when we start to see some of the wrinkles set in or the hollowing out of the face, which sometimes comes with aging, there are things that we can do to mitigate that.
Absolutely. You know, of course, that comes in with things that we've talked about, you know. Obviously, every 3 or 4 months, you're going to do something to kind of relax the muscles that are contracted and causing wrinkling in the face. That's your Botox and Dysport. And then little areas like that won't respond to that, we can fill it in. Like you need to revolumize the cheeks and fill in the fine lines with our Artifill, Juvederm, and Restylane. That's usually going to be 9 months to a year cycle.
And then something you would do about biannually is like the Active FX or Deep FX?
Yeah, our Active FX, of course, is a resurfacing, and that's going to really put a beautiful new surface on the skin, correct enlarged pores, texture issues, refine the skin, and also remove deep brown spots.
Yeah.
And that really kind of just gives you a running start. and then you can kind of go back to the beginning and start, maintaining with your home products, doing this about, on the average once a month, and keeping your muscles relaxed with the Botox and a little filler. You can basically achieve virtually the same effect as a facelift.
Yeah, and Dana, tell us what you're doing right now with this light.
This is an LED light, and it helps stimulate collagen, improves cell turnover. It's really great. In fact, NASA just did a study on
A bunch of nice studies that show that it stimulates fibroblasts and collagen in the skin.
And that helps to plump out skin.
That's right.
The other thing is we have a blue light for acne. So for like teenagers that have bad acne on their face or their back, this actually kills the bacteria,
that causes acne. Yeah, and especially for teenagers, especially for girls, there are certain medications that doctors are very hesitant to prescribe.
Absolutely.
So this is one of those things that's a much safer way of dealing with the acne on the face.
Yeah, we can even use an augmented peel, like with a Levulan peel that helps with acne, and it's good for body areas like people have acne.